Well, Lindsay's come back from Canada. So, well, not come back from Canada. She's still in Canada, obviously. I'm in England. And it is Thursday, the 22nd of April. Lindsay, thank you for coming back. Really appreciate it. Now, there are a few concerns about Canada, aren't there, in the way things are going? But basically, start us off. Over to you.
Yes, John, thank you very much for having me. I'm happy to be here. Canada is in a very difficult place right now. We are well into our third wave of COVID-19, and I'm very concerned that this could be our worst wave yet. Hopefully, this is also our last wave. So I will start by trying to put this into context for you. A couple of weeks ago, the CDC actually gave Americans a warning about traveling to Canada, and they're advising Americans not to travel to Canada unless they absolutely need to because of the current situation in Canada. And they're also telling Americans only to travel here if it is essential, like I said, and also if they're fully vaccinated. And that is quite a turning point because for the majority of this pandemic, Canadians have been looking at the United States and saying, oh, it's so terrible what's happening down in the States. And now we see how quickly the tables have turned, largely due to our inability to be proactive and also our very slow vaccination rollout. It's coming, John, but it's slow, and we're in a very complicated situation here in Canada right now.
I think that's one of the hallmarks of this pandemic, Lindsay, really, the way that things can change so quickly. Mm-hmm. You know, the India situation a few weeks ago was looking good. Now it's just terrifying. And Canada, the same. It was looking good for a long, long time. And then cases started going up quickly. Yeah.
Yes. And I also would like to share this. This needs to happen in Canada as well, John. We definitely need to be more proactive and less reactive. And I think you share that sentiment with me. Mm-hmm. The other problem that we have in Canada is that we do not have a national strategy. So every province or territory is managing this pandemic in the way that they see fit. So we have all of these different expressions of the pandemic. So what you see in my province of British Columbia is very different than what you might see in, say, an Atlantic province. So I think that's confusing for people as well across the country.
And what about travel around the country? What's the regulations on that at the moment?
Yeah, so travel is being discouraged, formally discouraged, but anyone could really jump on a plane. There's nothing banning interprovincial travel. Now, the Atlantic provinces, they had what was called the Atlantic bubble. That has now burst because they do have some cases there. But they've been restricting travel. And Prince Edward Island earlier this week, they just had a few cases pop up and they said, that's it. We are not allowing any travel from any other provinces, including the provinces of the Atlantic bubble. And in doing that, they will protect themselves. Now, my province of British Columbia, that was being asked for months ago. Please, could we stop interprovincial travel? Because at the time they were worried about a neighboring province of Alberta having cases that were spreading here. And they said that the legal advice that they had gotten was that they could not do that. In that same week, the province of Manitoba, which is central Canada, started to ban interprovincial travel. So I don't understand why one province can do it and another province can't. Now, this week, British Columbia has said that they are going to restrict this type of travel. They're going to put signs up at the Alberta border. But I mean, it's really difficult if you don't actually mandate something, because if people can travel, they still will. And we are seeing the variants spread because of this. It's really difficult to know how serious this is and to watch it happen as a citizen of the country.
I mean, governments are there to govern, aren't they? You know, why don't they use these powers and just get on with it? I mean, because we're getting so close to the end now. You know, as you say, the vaccines are coming. But you mentioned the variants there, Lindsay. What are you worried about?
Yes, so we have the three main variants, I guess, that have been identified, circulating throughout Canada. My province of British Columbia, we have the P1 variant here. Yeah. And there was a huge outbreak of that in Whistler, which is a ski area. It's a ski village, but it's very, very well known worldwide. And there was a P1 variant outbreak going on there for weeks. And just recently, they closed the village, and now they're trying to vaccinate everyone there. But by that point, we had so much P1 spreading out to other health regions. And also, what happened is there was a case taken from Whistler to Alberta, which is the province right next to us. 35 people from this one case with a P1 variant, 35 people became COVID positive and one person died. So these are lives that are at stake. This is a preventable disease now. We have vaccines for this. So, and now the P1 variant in some places in British Columbia is actually 50% of cases, and the other 50% are the B117 variant. And the B117 variant is becoming dominant as predicted in most places in Canada. So I'm very concerned about these variants. These variants are up to 2.4 times more transmissible. We're seeing younger people in hospitals in Canada right now. We're seeing younger people who are getting severely, severely ill and even dying. Kids are being orphaned. We have parents who are in the hospital and children are at home having to fend for themselves, even while they're COVID-19 positive. I know about this. There's one case in Whistler where this has happened. It's very, very, it's difficult, John.
Yeah. So the P1 started in Brazil. I think that's the Amazonian variant, isn't it? And of course, the B117 is called the UK or the Kent variant. And as you say, we know these are more competitive. So basically, the P1 and the B117 between them have excluded all the older forms of the virus because they've outcompeted them by being more transmissible. And this is at least a large part of the increase that we're seeing. But of course, this could have only have happened if the travel had still been going. Otherwise, this would have been much more localized. It's the travel that's allowed this to spread out and diffuse.
And we do have restrictions in Canada. So if you're coming from out of the country, you do have to quarantine in a federal hotel, and you have to pay your way. It's about $2,000 for a 3-night stay there until you get a negative test. But there are many, many reports that a lot of people are just leaving the airports and they're completely disregarding this. And so I think we're seeing spread because we're not surveilling. We don't have enough surveillance going on to handle this. It's one thing to mandate it. It's another thing to enforce it.
You always got to go to the lowest common denominator, haven't you? You know, if some people are going to abuse it like that, then really enforcement is surely the only answer, isn't it?
Unfortunately, yes.
Yeah. And it sounds like you've got a little bit of South Africa variant in Canada as well. I don't think as much, but
it is in many provinces. Yes.
Yeah, Well, I don't know. Therefore, I'm worried because in this pandemic, I found it sort of pays to be pessimistic, really, to some extent, about the India variant. Is there travel between India and Canada?
Yes, there is. And I know that in my province, we've had about 39 different cases of this Indian variant. And there were reports this week in the Vancouver Sun, which is a newspaper here in British Columbia, that we have people from India traveling on planes, multiple planes per day, that are coming to British Columbia, and they're already sick on the plane. And our federal or our provincial authorities would not comment on this, but it's extremely concerning. And it's hard to also have empathy for our governments at this time, because Canada has the advantage of seeing all of what's going on, and we usually have a couple of weeks notice. We saw what happened in the UK. We saw what was going on in India. And at this point this week, our Prime Minister, the headline is that he's contemplating whether this is serious. And we need to be proactive. Our hospitals in most places in Canada are, if they're not full, they're very close to being full. I mean, John, they're trying to recruit pharmacy technicians and pharmacists to be trained as nurses in some places in Canada right now. This is really, really serious. We cannot play around with this any longer.
I mean, we're scientists. We try and keep it cognitive, but I just lose it from time to time. Why, oh, why are we still having flights from India when we can see what the variant is doing to that country? And it's heartbreaking to see.
It is.
And yet we carry on with flights for what? All we need to do is suspend them for a few weeks until we get on top of this. It's just...
That's right.
Dear, it's just, it's difficult.
Really, it's really maddening because these are people's lives. People will die who do not need to die because of the lack of action, right? So, sorry, I'm a little bit feisty today.
No, it's just beggars credulity. It just can't be understood. But the hospitals in Canada then, in quite a few cases, really quite stretched.
Yes.
At the moment.
Yes. Yes, they are. We have many hospitals are now using what is called surge capacity. Reports of patients out in hallways, patients being put in shower rooms and sunrooms. And it's not just beds, right? We need people who can staff these beds, people who are well trained. I know in the province of Ontario, they're now choosing who will get ICU care and who will not based on what their likelihood is of survival. So the most recent report was that if you don't have a 70% chance of survival in ICU, you might not be considered for this type of care. And when we have resources stretched this thin, it has a cascade effect throughout the whole healthcare system. So if you have a heart attack today in certain places of maybe Ontario, maybe the care you're going to get wouldn't be as good had we controlled this pandemic and had we kept our numbers down. We'd be in a totally different position.
Well, to be quite honest, I don't think there's too much maybe about it, is there? I mean, it's even in normal circumstances, I've actually gone into a corridor in accident and emergency departments and found people who've been sitting there for quite some time with chest pain. Just you haven't got to them, and they should have been in straight away, absolutely instantly. And if that can happen at the best of times, then now it's going to be much more of an issue. Yeah. What about you personally, Lindsay? Have you haven't had a vaccine yet, have you?
No, I haven't. I do have an appointment coming up, but
so you're a public-facing healthcare provider in a pharmacy.
Yes, pharmacists were. This is different in every province. So I'm in British Columbia. Pharmacists were given the opportunity for vaccination a few weeks ago, but there is a wait list for that. So I've been booked for a vaccine. But yes, some pharmacists are vaccinating without having been vaccinated themselves at this point. But we did that during flu vaccine as well. It's not ideal. I mean, especially with the new variants that are more transmissible. I'll show you, John, quickly, because
it's more than that. It's a real worry because you're at risk.
That's right. That's right. So when I do vaccinate, I'll show you this because now with the new variants, I think eye protection is also important. So we know that masks are really important. Yeah. But this is what I wear when I vaccinate. So obviously I'm wearing a mask, and I'm also wearing these glasses. So these glasses, anyone could get these. These are online from a certain supplier.
Yeah.
And you can see.
Yeah.
Along the sides.
Yeah.
So
Yeah.
And
that's really clear. Yeah.
I also wear these to go grocery shopping, John. I mean, at this point, I think that any protection that we can have is these were not expensive. Anyone.
I agree. There's no question that a virus can get from the air into your eyes and cause infection. I don't think that's in doubt.
And we are starting to see outdoor transmission as well, John, which is something that
really. What?
Yeah, so I have a case here from an intensive care physician in Ontario. So I'll just lay the scene for you, John. 6 people in a backyard for 2 hours. The next day, one person is symptomatic. They get tested. They're COVID-19 positive. 5 days later, 2 more of this group are COVID-19 positive. They then realize, or it's found through testing, that this is the B117 variant. One patient is now hospitalized and on 100% oxygen. And the patient says, well, I guess earlier on, the patient says to their physician, I thought outdoors is always safe.
Yeah.
And this is a really important point. And outdoors is safer than indoors. And we should get outside and we need to get exercise. And if you're socializing, keep your distance, but you can still, speak to people and have some kind of social interaction. But it's not 100% safe. And
so it sounds like they've been outdoors and not respected social distancing, not been wearing masks.
Because people have the impression that outdoors is fine. So as long as we're outdoors, we can be okay. So you have 6 people, maybe they were sharing a meal over a couple of hours, so they're not distanced, right? And this is the kind of thing that could happen. And we're going into what we call, I guess, barbecue season,
Sure.
spring and summer. And people are doing this thinking, oh, this is okay, it's fine. But you know what? With these new variants that are so much more transmissible, we really have to be aware that we still need to keep our distance, especially, in Canada, because many of us are still not vaccinated either.
Yes. I mean, outdoors is got to be innumerably times safer than indoors.
Oh, yeah.
But you need the social distancing as well, especially if you're in contact with someone over a period of time, and especially if you're talking. Now, thankfully, I'm talking away here in Lindsay's in Canada, so she's probably okay. But if she was where my camera is now, then you would be getting flooded with viruses from, and especially if there's three or four people talking, and you tend to talk quite loudly, then talking is associated with huge viral shedding, with a lot of momentum behind the virus as well. So it's a good point, and it does show how much more transmissible these variants are. Yeah. Anything else in Canada you'd like to bring up with us, Lindsay? It's interesting so far.
Yeah, well,
numbers are up. Deaths are lagging about a week behind the increasing cases. About 3 to 4 weeks behind the increasing cases typically.
Yes. So our positivity rate in Canada is at about 3.9%. Right. And I think that our deaths are up about 2.2%.
Case fatality rate.
Case fatality rate is 2.22%.
Yeah.
So in Canada, 1 in 45 Canadians with COVID-19 have died since February 2020. Okay, so that's our case.
45. It's really quite high, isn't it? Yeah. So that 3.9% basically means there's quite a lot of community transmission. I think that shows that the virus is somewhat endemic.
There is, and I mean, look at the size of Canada. So that varies widely. In my province of British Columbia, we're looking at about 9% positivity rate right now, higher in some areas, lower in others. Schools are still open. It's a bit scary. I have children right now, and they're going to school, and they're masked, but
and neither you nor your husband are vaccinated.
No, we're not. We're not.
Yeah, and children, of course, younger children less so, but they can still spread it. Older children less than adults, but they are obviously still spreading it to a fair degree. And I think it's worth saying the case fatality rate of 2.2 will be significantly higher than the actual infection fatality rate. Of course, we don't know that because you don't know how many people you're missing through testing. But for a country like Canada that's doing quite a bit of testing, I think. I mean, the testings there is quite reasonable, isn't it? 2.2 case fatality rate, relatively high.
We're doing about 102,000 tests a day. That was from 2 days ago. So we are doing a fair amount of testing. We should be doing a lot more testing. But do you know if there's much
genomic testing in Canada, Lindsay?
We have some, and they've tried to ramp this up. I just don't know if we have the ability to focus on testing, genomic sequencing, vaccinations. It's almost like there's too much going on. I know in British Columbia, with these variants that we have, there's been some very questionable decisions made about the amount of sequencing we're doing. Our public health office has decided to stop sequencing as much because they're just going to assume now that every case is the B117 variant, and then they will do random sequencing. So the picture that we have right now of, say, British Columbia with our situation with P1, I don't really know if that data is very accurate. We've had over 1,800 cases of the P1 variant in British Columbia, but is that a true picture of what is going on? And many people are questioning and saying, probably not. And if we would be more transparent with people, maybe we would be able to get people more on board with the seriousness of the situation.
I was surprised how poor the genomic testing is in the United States. It's really
Is it?
Yeah. We were just lucky in the UK. We had this sequencing project going because we wanted to sequence 100,000 human genomes to correlate with disease. So this facility had just been set up, Genomics England. So we were kind of fortunate, really. the sequencing capacity was there, but it was good luck rather than good management, I think. But,
yeah, the UK has led the way for sure.
It's been fortunate, yeah. Okay, what else? Anything else worrying you particularly about Canada, as if that's not enough?
Yeah, I would like to speak a little bit about what we're seeing with COVID-19 and pregnant women.
Oh, yeah.
So we know that in pregnancy, if you do develop COVID-19, you are 3 times more likely to end up in ICU and 2 times more likely to die from this infection. Pregnant women, their immune systems are not it's not that they're not as strong. How would you explain this, John? They're somewhat compromised, and that's so their body does not recognize the fetus as something that is a threat to them.
It's quite amazing, really. I mean, if you think about it, the fetus is only 50% mum, it's 50% dad as well, more or less. So basically, it's foreign tissue. So, for example, if you were to take one of your children's kidneys now and put it into you would very, very probably, almost certainly reject it. And yet they were inside you for the 9 months of the gestational period. So basically, the immune system has to be toned down a bit during pregnancy. There's a level of immunocompromise. I think it's important to say that the ×3 admission to ICU and the ×2 likelihood of death sounds bad, but you've got to bear in mind, as I understand this is related to other women of comparable ages.
That's right.
So we're talking about relatively low overall risk, but an increased relative risk. But it's still a very significantly increased relative risk.
Yeah, and I think it's a reflection on when we have widespread community transmission.
Yeah.
Obviously, these people are going to be more vulnerable to disease. And so what they're seeing, especially in Ontario right now, because Ontario is in a terrible, terrible spot right now during this pandemic, is they're seeing that even up to many of their hospitals, about half of their ICUs, the patients are pregnant women. And what's happening is these patients are very difficult. They're more difficult to intubate. They're even having to prone some of these women and put them on their stomachs so they can get more oxygen into them. We're seeing reports of emergency C-sections going on. It's really, really difficult. And an obstetrician, Dr. Mark Walker, out of, I think, maybe Ottawa or somewhere in Ontario, is asking that pregnant women be prioritized for vaccination. Now, that's difficult because we don't have a lot of data right now from these trials, because we don't do trials on vaccines in pregnant women. But there is a study that's out of the New England Journal of Medicine that I saw yesterday that it was a sample size of about 3,500 people, and there were pregnant women who had been vaccinated, and they did not note any safety signals regarding vaccination, and there were no abnormal statistics as far as adverse effects from those.
Yeah.
So
in the UK, Pfizer is now authorised in pregnancy. Not the Oxford AstraZeneca, but the reason for that is that's just where the data is. I think it's turned out from the CDC in the United States that they happen to have vaccinated about 80,000 women in pregnancy with the Pfizer and Moderna vaccine. So and basically it's well, you can never say safe, but it's quite acceptable to use it in pregnancy. So I think in the UK, the guideline something like in discussion with their healthcare provider, which is a bit of a pathetic cop-out from the government, really. But basically, it's saying in the UK that the Pfizer can be given in pregnancy in most cases, is what they seem to be saying. So, but of course, like with anything else, ideally people would optimize their nutrition and make sure all the vaccinations are done preconceptually, which is the ideal situation. You're like me, you probably spend quite a lot of time teaching what we call pre and periconceptual health, where you want to optimize all these things prior to conception occurring, if you possibly can.
Yeah, and I think this concern and this need for vaccination, when we're talking specifically about this population, it's because we're in such a difficult situation. We have widespread community transmission, and so these conversations are having to be had over the benefit versus risk of vaccination, because the risk of COVID-19 is very, very real right now in Canada.
Absolutely, yeah. So we're coming into summer now, Lindsay. How do you see things panning out next few months?
So as of today, about 25% of our population have been vaccinated. but most of Canada is taking the approach of a 1-dose regimen, the second dose being in about 4 months.
Much the same as the 4 months, yeah, even more than the UK. Yeah.
Okay.
So
we're
supposed to be within 3 months.
Yeah. So about 2.42% of our population has had 2 doses of the vaccine. So back to your question,
not enough.
How do things look? We really need to restrict interprovincial travel, and we need to restrict all international travel, not just flights to Canada. Many flights that are coming to Canada come through other countries too. There's different stopovers, and so we can't just ban all flights from India. I think we need to stop all travel, like you said, for a good 2 to 4 weeks. We need to stop interprovincial travel, and really getting cases down would get us into quite a nice summer. It would give us some time to get people vaccinated, because we do not have domestic vaccine manufacturing here. So we are limited by supply. Our vaccine rollout is slow. But if we could limit travel, if we could get our cases down, I think that summer could be quite nice. I think COVID will still be with us into the fall. We'll still be talking about this.
Oh yeah.
But based on what we do now will dictate the kind of summer that we have in Canada. So we'll see.
I think President Biden's hoping for a fairly normal summer, but their vaccination program is going more quickly than Canada's.
Yeah, I heard this week the province of Manitoba. So there's a lot of truckers that go in between the United States and into the province of Manitoba. And the United States, they've actually agreed to vaccinate these truckers, these Canadian truckers that go in between Canada and the US. And kudos to them for doing that. I mean, Canada shouldn't be in the position where we have to ask for help like this, but you know what? We need to take whatever we can get, and getting people like these kinds of workers and essential workers. Many of the cases in Canada that are in hospital are essential workers who don't have paid sick leave. They need to work to make money for their families. This is who's being affected in Canada right now, and it's really devastating. So we'll take all the help that we can get right now.
Absolutely. Couldn't agree more. Yeah, it's great, Lindsay. That's a really good update, actually. So hopefully things will get a bit better in summer because of the weather anyway, but with such a momentum of cases, we're basically in uncharted territory for the next few weeks.
Yeah, we're in quite a storm right now, and now that we're in this storm, these provinces and governments are now acting. Are they doing enough? I don't know. They're doing more than they were doing a few weeks ago. But I think it also comes down to all of us as citizens. We all have to now, knowing that we're in this situation with the new variants, we need to do all of the things we were doing before, but the stakes are much higher. So we need to mask better. We need to keep our distance. We need to be even more conscious. We are so close to the end of this, John. And I just feel for Canadian citizens who have been hearing about this for so long, and now we're really in a difficult place here. But we've also have got vaccinations happening. So
it really isn't long, and I'm sure President Biden will be sending you a few million doses of vaccine pretty soon, because they're making so many in the States. That will really accelerate the rollout. But so if you're listening, we are near the end. It's not long now. Just carry on with the precautions and the non-pharmaceutical interventions, and the vaccines will be doing the heavy lifting pretty soon.
Absolutely.
Yeah, great. Lindsay, thank you, of course, as always.
Thank you, John.
Links to Lindsay's interesting, fascinating channel on all aspects of pharmacy and health below. Click on watch her, and be there or be square. Don't get bored.
That's great, John. Thank you.
Yeah, Lindsay, thank you. Thank you very much.
Take care. Bye-bye.
Thanks. You too. Bye.